Welcome to the deep dive. Today we're talking about something really key for how healthcare operates and improves. Performance management. It's kind of like the system behind everything that helps hospitals and clinics, really perform well, care-wise and efficiency-wise.
Exactly.
I've always wondered how these big, complex places really know if they're, doing a good job.
And that's just what we'll be digging into. We're going to break down how healthcare organizations really monitor their performance and make real improvements.
Okay.
It's more than just, catching mistakes. It's about always trying to get better, which in the end helps every single patient.
So we've got some interesting material here on how they do that. We'll look at what makes them start an investigation,
The triggers. Yeah.
the triggers,
Yeah.
and how they measure up against others.
Benchmarking.
Benchmarking, right.
Right.
And the sort of frameworks like scorecards they use to see the whole picture. Our goal here is really to give you a clear picture of how looking at data and being proactive leads to, well, better care and smoother operations.
Sounds good.
Okay, so let's start with that basic question. What actually makes a hospital or clinic pause and say, hang on, we need to look into this?
Right. So those moments usually happen because of what we call triggers. Think of them like signals in the data.
Okay.
They show that maybe things aren't quite meeting the expected standard. They're like alerts, really, pushing for a deeper look.
But there must be tons of data. How do they pick the right signals?
That's the challenge, finding the meaningful triggers and all that noise.
So what kinds of signals are we talking about? What actually gets their attention?
Well, there are a few main types. First, you have quantitative metrics. These are the hard numbers, often rates.
Like infection rates per number of days patients are in the hospital.
Exactly, like infections per 1,000 patient days. Using rates like that means you can compare more fairly.
Right, because just counting infections doesn't tell you much if one hospital is way bigger than another. Rates normalize it.
Precisely. It levels the playing field for comparison. Then another big one is sentinel events.
Okay, what are those? Sounds serious.
They are. These are really serious adverse events, things you absolutely don't want to happen, like surgery on the wrong part of the body.
Oh, wow.
Events like that aren't just flags. They automatically trigger a huge review, a root cause analysis to figure out exactly what went wrong and how to stop it ever happening again. It's a non-negotiable.
You absolutely have to investigate that.
Huh?
Makes sense. What about trends? Maybe things that aren't disasters but are still, worrying.
Yeah, that's where statistical deviations come into play. If a number, a metric, consistently lands way outside the normal range, say 2 or 3 standard deviations away from the average.
Standard deviation, that's like how spread out the numbers usually are.
Exactly. So if you're way outside that usual spread, it signals a potential issue. And similarly, control limits, that's an idea from statistical process control. Okay.
They help you tell the difference between just the normal random fluctuations, the everyday ups and downs, and a real problem that needs looking into. They set sort of upper and lower boundaries for what's expected.
Got it. So it's not just hitting a target number, but staying within a predictable range. What questions are these triggers trying to answer, fundamentally?
They basically boil down to 3 key questions. 1, is there actually a problem here? Does the data show something off?
Okay.
2, should we be doing something proactively? Maybe things aren't terrible now, but is there a trend suggesting we need to act before they get worse?
Uh-huh.
And 3, can we improve care or service? This is that continuous improvement idea. Even if things look okay, can we do better?
That really highlights that it's not just about fixing mistakes, but always aiming higher. Can you give some concrete examples of these triggers?
Sure, a sentinel event, like we said, could be a serious medication error causing harm.
An expected performance rate trigger might be, say, a hospital aiming for surgical site infections below 5% for certain clean surgeries. They go
Right.
over that 5%.
Trigger, investigation time.
Exactly. It kicks off a review.
Okay, clear enough. What about seeing changes over time or maybe differences between, say, different clinics in the same system?
Good examples. A specified rate change over time could be if a hospital notices its C-section rate jumped more than 5% in 6 months. That warrants a look into why, and a specified difference between groups. Maybe you compare hospital admission rates for patients seeing different primary care doctors in the same network. If one doctor's patients end up in the hospital way more often.
You'd want to know why that difference exists.
Right. Is it something about the patients or the care? It signals a need to understand and maybe share best practices.
And the statistical range example, how does that work?
A derived statistical range. Think about recovery time after anesthesia. Maybe it's normally 1 to 2 hours. If patients are consistently taking longer than 2 hours, that could trigger a look at the post-op process. Are there delays, complications?
Okay. And those control limits you mentioned, how are they used in practice?
They're really important for telling normal variation apart from what we call special cause variation, something specific that's gone wrong.
Right, separating the signal from the noise.
Exactly. Hospitals often use standard deviation to set these limits for things like, say, ER wait times. They track the average, calculate the limits based on past data.
And if a wait time spikes above the upper limit.
That's a signal that something unusual might be happening, something beyond the normal day-to-day variation. And what's really cool here is that machine learning is starting to be used.
Oh, interesting.
Yeah, using real-time data and predictive analytics to calculate these limits even more precisely, making the system more sensitive to potential issues.
Wow, so using AI to sharpen those early warnings. Now, you also mentioned triggers that aren't just numbers.
Yeah.
What about those qualitative things, external factors?
Absolutely crucial. Patient and staff feedback is a huge one. Surveys, complaints, even compliments.
Compliments too.
Definitely, they tell you what you're doing right. But yeah, feedback gives you direct insight into things like wait times, communication, what the experience is actually like. And there's a lot of focus now, recent studies in 2024 really pushing for patient-reported outcomes, PROs, and getting that feedback in real time makes care much more responsive.
So listening directly to patients and the staff delivering the care. What about the hospital's own goals?
Right, strategic and quality planning. If the organization sets a big goal like reduce hospital readmissions by 10%.
That goal itself becomes a trigger.
Exactly. It triggers specific projects, and they track readmission rates constantly to see if they're hitting that target. Also, internal benchmarking.
Comparing different departments within the same hospital.
Or different hospitals within the same system, yeah. If one unit is doing way better on a certain metric, that triggers a look. What are they doing differently? Can we learn from them?
And looking outside the organization.
That's external benchmarking. Comparing your performance to others using data from places like CMS Hospital Compare, or maybe groups like the Leapfrog Group.
So seeing how you stack up nationally or against peers.
Right. Falling short on those external benchmarks is definitely a trigger for action. Plus, you have proactive quality improvement QI initiatives. These are often driven by new research or guidelines.
Like updates on infection prevention.
Exactly. Maybe new guidelines came out in 2023. Adopting those becomes an initiative, and you track how well you're implementing them and if they're working. That's a trigger too.
It really sounds like a 360-degree view, internal, external, numbers, feedback. Very thorough.
It has to be, really.
Okay, you mentioned benchmarking quite a bit there. Let's dive into that specifically. What does benchmarking mean in healthcare?
So benchmarking, at its core, is just a way for organizations to systematically compare themselves.
Okay.
Comparing their performance against standards could be internal standards, could be external ones like competitors or national averages. It's about understanding where you stand and finding opportunities by seeing what others achieve.
So learning from the best, essentially.
Kind of, but with a caveat. A common mistake is just trying to copy a best practice without understanding why it worked somewhere else.
Context matters.
Hugely. It's really about adapting good ideas, not just blindly adopting them.
Makes sense.
Yeah.
What are the main ways they do these comparisons?
Well, we can break it down. There's internal benchmarking, like we touched on comparing Department A to Department B within the same hospital, or Hospital X to Hospital Y in the same system.
Good for spreading successful ideas around internally.
Exactly. Identify your own high performers and learn from them. Then there's external benchmarking. That's looking outside.
Comparing to other hospitals, maybe similar ones?
Right. Comparing against industry peers or national data sets like from Leapfrog or CMS, it shows you how you measure up in the broader landscape.
Okay. Any other types?
There's also functional benchmarking. This one's interesting. It means looking at a specific process like patient discharge and comparing it to how that process is done really well, maybe even in a completely different industry.
Like comparing hospital logistics to FedEx or something.
Potentially, yeah.
Yeah.
If a logistics company is amazing at flow management, maybe there are principles a hospital could adapt for patient flow. It brings in fresh thinking.
That's a cool idea, looking outside the usual suspects. Now, when they do this benchmarking, what makes it tricky? What do they need to watch out for to make sure the comparisons are actually useful?
Oh, there are definitely pitfalls. A huge one is patient population differences.
Meaning?
Well, think about it. A big city trauma center sees very different patients than a small rural hospital, right?
Yeah, much more complex cases probably.
Exactly. Differences in how sick patients are, their acuity or their demographics, insurance status, all that stuff affects outcomes and costs. You can't just compare raw data.
So how do they account for that?
There are statistical methods like risk adjustment or case mix adjustment, and newer techniques too. I saw a 2023 study mentioning things like propensity score matching, using advanced analytics to try and make the comparisons fairer.
Okay, so you need sophisticated ways to level the playing field based on the patients themselves. What else?
Data collection methods. This is huge. If Hospital A defines hospital-acquired infection one way, and Hospital B defines it slightly differently.
The comparison is meaningless.
Pretty much. Or if they collect data differently, or adjust for case mix using different formulas. You need consistency. Standard definitions and methods are key for reliable benchmarking.
Garbage in, garbage out, basically.
You got it. Another thing is statistical chance.
Just random variation.
Yeah. Sometimes a difference looks big, but it might just be random fluctuation in the numbers, especially if you're looking at small groups or rare events. You need good statistical analysis to tell if a difference is real or just, well, chance.
Yeah.
And finally, maybe most importantly, you have to focus on the quality of care. The point isn't just to look good on paper.
Right.
If benchmarking reveals real differences in things like readmission rates or patient safety, that should be the driver for making changes to actually improve care for patients.
So always tying it back to patient outcomes and safety.
Oh,
Okay,
yeah.
that gives us a good handle on benchmarking. Let's switch gears slightly. How do organizations keep track of all this stuff across all the different parts of what they do? I've heard about something called a balanced scorecard.
Yes, the balanced scorecard. It's a really powerful framework. It moves beyond just looking at, say, the financial numbers.
Which I imagine used to be the main focus.
Often, yes. But the scorecard helps organizations track performance across several key areas or dimensions all at once.
Giving a more balanced view.
Exactly. A more holistic picture of the organization's health and progress towards its big goals. And crucially, it helps see the links between those areas.
How so?
Like how improving staff training, maybe in the innovation and growth part, could lead to better patient satisfaction in the customer part, which might then improve operations metrics like reduced errors. It connects the dots.
Okay, so it's not just silos of data.
Yeah.
What are these different dimensions or perspectives in a typical healthcare scorecard?
Well, they can vary a bit, but common ones include community, how they engage with and impact the wider community. Customer, looking at satisfaction and access for patients, doctors, even employees. Financial, bottom line, sustainability, efficiency.
Essentials.
Right? Then innovation and growth, developing new services, expanding reach. Operations, the core business of efficient processes and good clinical outcomes.
Okay.
And often, especially for teaching hospitals, you'll see a research and teaching perspective too.
That seems to cover pretty much everything. Could you give examples for each? Like, for community, what's the objective and what might they measure?
Sure. For community, the objective might be something like enhance community engagement and health equity.
Okay.
Measures could be number of health programs they run that directly address needs found in community assessments, maybe volunteer hours, or the percentage of uninsured patients they serve.
So really measuring their impact beyond the hospital walls. What about the customer perspective?
Objective there is usually about improving satisfaction and access. Measures, things like patient satisfaction scores, HCA-HPS is a common one.
That's the standardized survey patients get.
Yeah, but also maybe real-time surveys done right after an appointment, how fast they resolve complaints, or crucially, how long it takes to get that first specialist appointment.
Access is key.
Definitely. And telehealth data is becoming big here too, according to a 2024 AHA report measuring access and satisfaction through virtual visits.
Makes sense with how much telehealth has grown. Okay, financial. Seems straightforward, but what are the key measures?
Objective is financial health, sustainability. Measures include things like revenue or cost per encounter, operating margin.
Profitability, basically.
Yeah, or breaking even. Also, days cash on hand, how long they could operate if revenue stopped. And efficiency things like FTEs, full-time employees per occupied bed, staffing levels.
Got it. Keeps the lights on. How about innovation and growth?
Objective here is expanding the business, developing new things, so they might measure market share growth.
Are they getting bigger in their area?
Right, or revenue from brand new services they've launched. Even tracking referring physicians, are they getting more doctors sending patients their way?
Looking ahead, okay, now operations. This feels like the core healthcare part.
It really is. The objective is efficient processes and good clinical results.
Yeah.
Measures here are fundamental. Average length of stay for inpatients.
How long people are in the hospital?
Volume of outpatient visits, wait times for key things like surgery or imaging, and critical outcome metrics like 30-day readmission rates. Didn't the patient have to come back unexpectedly soon?
Vital signs for the hospital's clinical performance. And lastly, research and teaching for those places that do it.
Objective is advancing knowledge, training the next generation. So they'd measure things like the number of active research studies, hours spent training residents, number of publications in journals.
Showing their academic contribution.
Exactly. And one more point across all these perspectives now, there's a growing push, partly from CMS and others, to include specific health equity metrics.
Meaning tracking if there are disparities in care or outcomes between different patient groups.
Precisely. Are we providing equitable care to everyone, regardless of race, ethnicity, income, etc.? It's becoming a critical part of the overall performance picture.
Wow. So that balanced scorecard really does provide a comprehensive dashboard for running a complex healthcare organization. Much more than just finances.
It absolutely does. It helps leaders see the connections and make sure they're improving across the board, not just in one isolated area.
Okay, so let's wrap this up. We've covered a lot today in this deep dive on healthcare performance management. We talked about the triggers.
Those signals that kick off an investigation.
Right. From sentinel events to statistical shifts to patient feedback, and then benchmarking.
Comparing performance internally and externally, but carefully.
Yeah, considering patient differences and data methods. And finally, the balanced scorecard framework.
For that holistic view across community, customer, financial, innovation, operations, and research.
It seems like these are all really essential tools for healthcare organizations to constantly check how they're doing and find ways to get better.
Definitely. They're all about enabling continuous improvement, which is what you need in healthcare. The ultimate goal is always better quality, safer care, and more efficient operations.
And that translates directly to better health for patients and a stronger healthcare system overall.
Exactly right. It's this ongoing cycle. Monitor with data, analyze for insights, act to improve, and then monitor again.
It really drives home the importance of data and proactive strategies.
Yeah.
So as a final thought for you listening, think about these ideas: triggers, benchmarks, multidimensional scorecards in other areas, maybe your own workplace or other complex systems you know. What kinds of triggers might signal something needs attention there? What comparisons or benchmarks might be useful? It's a powerful way of thinking that goes way beyond just hospitals. Thanks for joining us for this deep dive.